Hello, and welcome to your first module in this course. In Module 1, you're going to be given an introduction to mental health. Let's begin. In this module, we will cover the history of mental health, present-day mental health, and defining mental health. So let us begin with our first topic, a history of mental health. Many people in today's society continue to view and misinterpret the topic of mental health. Examples of these interpretations include calling those who are mentally burdened sensitive or unable to deal with their problems, and considering going to a psychologist or psychiatrist as being insane. However, centuries ago, there was no field catering to mental health. Mental health care was non-existent. Those who showed signs of mental burdens were killed, imprisoned, or treated using harmful and deadly practices. In order to understand the extremity of these so-called treatments, we are going to look at three of them. They are exorcism, trephining, and bloodletting. Many people considered those who showed unusual or odd behavior as individuals who were possessed by demons or cursed by an angry god. Thus, many practices were conducted to rid the person of these evil deities. The most common was exorcism. In exorcism, incantations were said over a person's body and medicinal drinks were given to them. This was performed mainly by a priest. Trephining had the same objectives as exorcism, which was to release spirits from the person's body. In this practice, however, a small hole was made in the skull of the person in order to release the demonic spirits believed to be possessing the person's body. Many people died due to this practice. Now we move on to bloodletting. Now for those of you who have studied the topic medicine through the ages, this is a familiar word. Bloodletting was a common medical treatment that was used for 300 years. In bloodletting, blood is withdrawn from the veins of the person. This was also used to so-called treat mental disorders. A doctor even suggested that making a person bleed till their heart nearly failed would rid them of mental illnesses. Along with these deadly and harmful practices, mental health patients were often placed in prisons, almhouses, or confined to their own homes under the supervision of their families. This treatment was more focused on isolating the individual from others rather than curing the person themselves. In the 18th century, asylums were introduced. These were the first institutions created specifically for the purpose of housing and confining people with psychological disorders. These asylums were often windowless dungeons where people were nearly beaten to death and were given no contact with the outside world or any proper treatment. To summarize this topic, in the past, mental health was regarded as a disease or demonic possession rather than a vital and important sector of our overall health. As we have just learned, practices that were used to treat people usually killed them due to the misinterpretation of the field. There are many paintings depicting the pain and suffering of those who were mentally burdened and what they had to go through centuries ago.